Welcome to a Kelly File investigation on the growing VA scandal. I'm Megyn Kelly. Tonight we dig into a situation that has been called an outrage and a betrayal of the ideals we ask our troops to risk their lives for. That blistering condemnation from Barack Obama himself back in May 2008, when as a candidate for the Oval Office, he ripped the Bush administration over the story of an 89-year-old vet who reportedly committed suicide after being denied access to health care. Flash forward 6 years, and the same story is now playing out, but on a much bigger scale, this time with Barack Obama at the helm. Investigations are now underway at more than 24 VA facilities where veterans could not get timely care, and staffers allegedly tried to cover it up with what we are told were sometimes deadly results.
Never before have I seen an allegation of the cover-up of 40 people dying.
Senator John McCain expressing shock about events at the Phoenix VA hospital, ground zero to a story that took an already troubling state of affairs to a new and disturbing low. December of 2013, Dr. Sam Foote of the Phoenix VA retires and publicly details allegations that patients have died at his facility while awaiting care that would never come. Dr. Foote alleges veterans are being ignored, that wait times are being falsified. That same month, investigators visit Phoenix to look into these and related whistleblower claims. Months would pass, and then April 9th. The story explodes when the chairman of the House Veterans Affairs Committee speaks out, detailing the extent of the Phoenix VA's alleged fraud, saying 2 sets of records were kept. One that was secret with the real and lengthy wait times, another that falsely showed bogus 2-week waits. Investigators believe as many as 40 veterans may have died while waiting for appointments. Dr. Foote later appeared on the Kelly File.
You say literally that veterans are dying and have died as a result of this shoddy system at the Phoenix VA where they are literally just ignoring veterans until they die. Explain.
Well, Megan, what happened was in February 2013, they started a secret waiting list. It was a paper list.
Family members of the dead are stunned and outraged.
She said, well, we have him ready for a primary care doctor. And that's when I screamed at the lady. I did scream. And I told her, you got to be kidding me. You're way too late. He died thanks to you guys.
As the Kelly File reports, the president stays silent until Fox News asks him directly about the scandal.
The moment we heard about the allegations around these 40 individuals who had died in Phoenix, I immediately ordered the Secretary of Veterans Affairs, General Shinseki, to investigate.
A few days later, Secretary Shinseki says some officials in Phoenix have been placed on leave, but the American Legion says more heads should roll.
It is with great sadness that I call for the resignations of Secretary Shinseki, Undersecretary of Health Robert Petzel, and Undersecretary of Benefits Allison Hickey.
The White House continues to stand by VA leadership.
The President remains confident in Secretary Shinseki's ability to lead the department and to take appropriate action.
Meantime, a warning that this goes well beyond Arizona.
It's not just Phoenix. That's what everyone needs to know. Phoenix is an example of a much larger problem.
By May 8th, the House votes to subpoena emails from top VA officials. The Senate holds a town hall on the scandal. An overflow crowd is in attendance and gives the senator an earful.
I'm here to tell you that my dead veteran husband cannot be much more patient than he is today, but me, I'm pissed.
By May 12th, the scandal has spread across a number of states. The next night, hundreds pack another town hall in Phoenix. An event that was supposed to last 1 hour goes for 4.
We veterans do not get the care necessary or the diagnoses necessary to give us the proper treatments that we need. This is what we get.
2 days later, May 15th, Secretary Shinseki fights to keep his job.
Any allegation, any adverse incident like this makes me mad as hell.
Would you explain to me, after knowing all this information, why you should not resign?
Well, I tell you, Senator, that I came here to make things better for veterans. That was my appointment by the president.
By May 20th, administration officials try to tamp down the alarm on Capitol Hill. That same day, we learned 26 VA facilities are being investigated nationwide. On May 21st, nearly 6 years to the day, after condemning the betrayal of veterans, President Obama makes his first extended public comments on the scandal.
I know the people are angry and want swift reckoning. I sympathize with that. But we have to let the investigators do their job and get to the happen.
No sooner was the president done with those remarks than the questions began. Why is he waiting for this report when there have already been several investigations, warnings about wait times going back years, and multiple reports from the Government Accountability Office about a system where employers were using tricks to hide what was really going on with our health care for our veterans? Joining me now, Daniel Dellinger, who's the national commander of the American Legion. You saw him in that piece. And Ralph Peters, who's a retired Army lieutenant colonel and a Fox News strategic analyst. Gentlemen, thank you both so much for being here. National Commander, let me start with you. In the words of Barack Obama, this is a disgrace. What has changed? What has changed in the last month versus what we've been seeing over the past 6 years when it comes to the treatment of our veterans in this healthcare system?
Unfortunately, we see nothing changing, and that's the problem. We really expected the Secretary Shinseki and the President to be very proactive in this, be very decisive, and make changes necessary immediately, but we haven't seen that.
Ralph, I know that you are a defender of General Shinseki's, and he has very few of them right now because people are so concerned about the American veterans. But make the case for why this distinguished man who has served our country so loyally and nonetheless is overseeing an agency plagued by such failures should stay in his role.
Well, Megan, blaming General Shinseki for problems that have developed over more than a half century, it's like blaming your doctor for your cancer. And I always ask those who are crying to lynch General Shinseki, who would you replace him with? Who even wants this thankless job? People generalize and say, well, we need to bring out an outside expert. Okay, who? Give me a name. Name names. Tell me what you're going to do. And that's the other thing, Megan, that really bothers me about all this. On both sides of the aisle, I'm hearing a lot of outrage. Some of it sincere, some of it I suspect mock because people have known about these problems for a long time. I'm hearing a lot of accusations, but I'm not hearing people tell me how to fix it. And I think the National Commander of the Legion and I would agree on this, that this is a complex and a terrible problem. Our vets deserve better, but it's also hit the VA with a perfect storm. We've not only got the Vietnam vets aging now and needing care badly, we've got vets from our recent conflicts who we were able, with the miracles of modern military medicine, to keep them alive. They would have died in previous wars, but they require greater levels of care. And what do we have? We're trying to treat them with a civil service where we protect the bad actors, government union rules that protect bad actors, procurement rules that keep our technology, our administrative technology, in the dark ages. I mean, it's just one thing after another. So I just see General Shinseki as, in 5 years, struggling to undo 50 years of underfunding and neglect, and he's the wrong guy to blame.
When you talk about some of the bureaucratic problems in terms of firing bad apples, the Congress tried to do something about that this week, and the Democrats in the Senate stopped it. The Democrats in the House voted for it. More control in terms of hiring and firing. The Democrats in the Senate said no. National Commander, your thoughts in response to what Ralph Peters has said about, this isn't General Shinseki's fault. This has been endemic. Obviously, the problems have existed and possibly grown since President Obama took office, but who would you put at the helm of this troubled organization? Where do we go from here?
Well, we agree that it is a complex issue, but also the reason, why was General Shinseki hired? He was hired to come into the VA, take the leadership that he had in the military, bring it forth into the VA, and make these problems go away. This isn't something that's new. There was a memorandum out in 2010 that outlined this exact problem. So they've had 4 years to do something about this, but we've seen failed leadership there. And
Megan?
If this is the military, then you're relieved of duty. If it's private sector, you're fired.
Go ahead, Ralph.
Megan, This is really, 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 really hard. It takes time to fix it. You need to fire people, but beyond that, you know, it breaks my heart that our vets are being treated so badly, but suddenly it's a crisis. General Shinseki has made some improvements. Where was the outrage during the Bush years? I'm not a defender of President Obama by any means, but this is a long-standing problem.
Okay, but let me ask you this, because I get that. So why didn't Barack Obama come out this week and say, we knew about this, we were informed when I took office, my team was, then we had updates in 2010. We were informed that there was a severe backlog for patients trying to see doctors, and that some staffers at various facilities were actively working to cover it up. They were told that. They were also told about the cover-up. So why didn't he come out and say, and this is what we tried to do to stop that and change the system? What we're learning now is that there were some failures. We didn't hear that, National Commander. We heard, let's wait for yet another IG report.
Exactly. And this isn't the first set of deaths. VA's already admitted to 23 preventable deaths, and then there was a report over the weekend where they paid out over $36 million of compensation for wrongful deaths. So they know that this has been an ongoing problem, and that's where the accountability, the transparency needs to come forward.
Well, gentlemen, it's good of you both to be here. Thank you so much.
Thank you, Megan.
Thank you, Megan.
We are also hearing suggestions that this VA scandal may be just a preview of government-run health care, of big government problems in general. Ahead, we'll investigate that. Plus,